Our focus for this month's Take It to Heart campaign is statin medications. They are often used as a preventative measure for anyone at a high risk of developing cardiovascular disease. Recently, the U.S. Preventative Services Task Force released its recommendations for statin use for primary prevention of cardiovascular disease in adults. Heart disease is a big problem, and doctors say that identifying who is at risk is an important step towards prevention.
Well, I think the first thing that's important and why we even discuss these issues is that cardiovascular disease is a big problem. There's about 500,000 deaths from heart attack and stroke a year.
Cardiologist Dr. Michael Rocco says recommendations from the U.S. Preventative Services Task Force call for adults between the ages of 40 and 75 to use a low to moderate dose statin for prevention purposes if they meet certain criteria for being high risk. Indicators such as age and whether a person has diabetes, hypertension, or is a smoker all factor into a person's level of risk. Previous research that has shown the likelihood that people would benefit from statin use is largely based on their absolute baseline risk of suffering a cardiovascular disease event. Dr. Rocco says that when it comes to primary prevention, the approach is not one size fits all.
What it should be is an indication to begin discussions between the doctor and the patient to carefully understand what the benefits of the therapy are weighed against the risks and what that individual patient is willing to accept.
Dr. Rocco says the recommendations are a starting point and that people who are at risk for cardiovascular disease should talk to their doctor and make treatment choices based on their individual circumstances. So Channel 4 wants to help you reduce your risk of heart disease. So together with the doctors at Baker Gilmer Cardiovascular Institute and our friends at Walgreens, we have put together the 4-on-4 challenge. So on the 4th of every month, remember these 4 steps. First, it's important to learn the symptoms and see how heart disease in women is different than in men. Second, know your risk factors like whether you're a diabetic or have elevated cholesterol. Step 3, stop smoking. Or if you don't smoke, make sure that you spread the word about how deadly the habit is. And finally, step 4 of the challenge, exercise. Something as simple as walking up the stairs instead of taking the elevator will put you in the right direction. Anyone can take the challenge. Head to news4jax.com, go to the health section and click on Take It to Heart.